Welcome to the International Diploma in Faculty Training, Module 2, that is Curriculum Development. I am Dr. Akshay Shafiq and I will be your facilitator for the first session, that is Introduction to Curriculum in Medical Education. What is the purpose of a curriculum? It ensures a structured and comprehensive approach to your medical education, and it aims at developing competent and compassionate healthcare professionals. So we will explore the literature a little bit to understand what curriculum itself is and what it encompasses. In 1949, Tyler said it's an intentional design or plan that guides educational experiences, which includes goals, content, teaching strategies, and assessment methods. Whilst Posner in 1992 referred curriculum to the totality of experiences, both planned and unplanned, that learners were encountering in their educational setting, subjects that were taught, the methods that were employed, and the overall organization and structure of the educational program. To 1995, Tanner said curriculum is a dynamic and interactive process, which involves the selection, organization, and sequencing of educational experiences to facilitate desired learning outcomes, which is just a small step ahead. Further, 1997, Jacobs said curriculum is an evolving and reflective framework which guides educational practice, incorporating the knowledge, skills, and values that are deemed essential. I would say the definition Smith provided in 2011 pretty much summed up the literature, stating that curriculum is the educational plan that outlines the knowledge, skills, values, and attitudes that learners are expected to acquire. In 2018, Choi stated that curriculum is a holistic framework that encompasses the selection, organization, and implementation of educational experiences, considering the needs of learners, societal expectations, and advances in knowledge and technology. In 2019, Kumar Anusun presented curriculum as a dynamic and responsive system that covers planned and enacted educational experiences, which included content, pedagogy, and assessment designed to achieve desired learning outcomes. Much the same as what Rajab said in 2020, that curriculum is an intentionally designed educational pathway that integrates knowledge, skills, and attitudes and values, prepares the learners for diverse personal, professional, and societal roles. In 2020, Bowling and Smith moved on to calling the curriculum as a flexible and adaptable system, which recognizes the individuality of learners, which promotes active engagement and fosters the integration for meaningful learning experiences. Lachuk and Fustata-Young mentioned curriculum as involving the intentional construction of learning opportunities, fostering the acquisition of disciplinary knowledge, critical thinking, problem-solving skills, and the development of professional identity. So we started off in 1949 as an intentional design or plan to guide educational experiences through various strategies. And some of these experiences, planned and unplanned, which we will be studying under hidden curriculum, including methods, organization, and structure of the educational plan in 1992. In 1995, we extended the same definition to express it as a dynamic and interactive process, which was further expressed as evolving and reflective and holistic framework or educational plan in 1997, 2011, and 2018. However, in 2018, it focused on the needs of learners, societal expectations, and advances in knowledge and technology, also adding the concept of pedagogy, which was pretty much summed up in 2019 as the dynamic and responsive system, adding the personal, professional, and societal roles in their definition in 2020, which took a shift to state it's flexible and adaptable and recognized the concept of individuals' individuality, engagement, integration, and meaningful learning, all of which are important aspects of medical education. And we closed this section of exploring literature with addition of intention in learning, discipline, critical thinking, problem solving, and professional identity in 2021. Moving on to the next section, we will be discussing about components of curriculum that work together to provide a well-rounded education. Number 1, knowledge base, which covers essential medical concepts, theories, and scientific principles students learn throughout their journey. Number 2, skills development, honing the practical abilities necessary for clinical practice, such as history taking, physical examinations, and procedural skills. Number 3, attitudes and professionalism, which emphasizes the development of ethical values, empathy, communication skills, and the ability to work as part of a healthcare system. Number 4, clinical experiences. They provide students with real world exposure, allowing them to apply their knowledge and skills in a clinical setting under proper supervision. So, there are four components of curriculum: a knowledge base, the development of skills, the attitudes and professionalism, and clinical experiences. The next section is about the types of curriculum. Number 1, traditional or subject centered curriculum, which follows a subject based approach. Each subject is taught separately in a linear progression, and the focus is on building foundational knowledge within each subject area. The second type is integrated curriculum, which emphasizes the interconnectedness of different subject areas. It aims to break down the traditional subject silos by integrating concepts, themes, and skills across multiple disciplines. This approach actually helps students see the relevance and applicability of knowledge in real world contexts. The third type is problem based learning, the PBL curriculum. It focuses on solving clinical problems and encourages active learning, critical thinking, and collaboration. Students are presented with real world problems or scenarios, and they work collaboratively to identify solutions, which promotes problem solving skills, self directed learning, and the integration of knowledge from various disciplines. The fourth type of curriculum is competency based curriculum. It emphasizes the attainment of specific skills and competencies which are required for medical practice. Thus, it includes assessments which are tied to these competencies that focus on the development and mastery of competencies for particular professions or fields. In this curriculum, learning is organized around clearly defined competencies, and students progress as they demonstrate proficiency in each area, and the assessments of these are closely aligned with the desired competencies. The fifth type is the learner-centered curriculum, which places the learner at the center of the educational experience, considering the individual student's needs, interests, and learning styles, allowing them for personalized learning pathways. It promotes student autonomy, engagement, and self-directed learning. On number 6, we have spiral curriculum, which involves revisiting topics and concepts which are repeated over time with increasing complexity and depth. It recognizes that learning is an ongoing process and it builds upon previously acquired knowledge and skills. This approach aims to reinforce and deepen the understanding through iterative exposure to content. Experiential or hands-on curriculum is the seventh type of curriculum. The name speaks for itself. Hands-on experiences and practical applications and real-world contexts which enhance learning. It integrates theoretical knowledge with experiential learning opportunities like internships, fieldwork, simulations, or laboratory experiments. This approach actually enhances students' understanding and application of concepts. Up on the list is hidden curriculum. It is actually the various aspects which include socialization, attitudes, values, the beliefs, the power dynamics, and cultural norms, which are transmitted through the school culture, the interactions with peers and teachers, and the overall learning environment. It is important to note that these lessons are often transmitted subtly and unconsciously and can significantly influence students' perceptions, behaviors, and understanding of the world. Last and maybe not the least, on number 9, we have online or digital curriculum, which utilizes technology and digital resources to deliver educational content and facilitate learning, just like we are doing right now. It may include interactive multimedia, online modules, virtual simulations, and collaborative platforms. This approach is totally flexible. It allows access to diverse resources and opportunities for self-paced learning. There might be other curriculum types that may be coming in future. With this, we move on to the last section, the curriculum development process. The process consists of 5 steps. Number 1 is task 1, which is needs assessment, which covers 20% of the initial step. Number 2 is setting learning objectives, with which we have 40% of the task done. Number 3 is content selection, which completes 60% of the tasks. And we have teaching methods and assessment as the fourth task, which completes 80% of the process of curriculum development. But you cannot wrap up a curriculum without knowing what are you doing and when are you doing, why are you doing it, and how are you doing it. And the last 20% is incomplete without the action and the implementation of the curriculum that you have constructed. With this, I would like to thank you all for listening to this session on Introduction to Curriculum Development. Everything that I've covered in this session will be covered deeply in the upcoming sessions by other facilitators. For queries and questions, please use the comment section and I will be happy to facilitate and respond. Take care. Goodbye.